Now that we have described how to best position the patient and how to best position the probe on the chest, we will now discuss a very important aspect of the ultrasound examination of the chest, and that is orientation. Precise knowledge of the anatomical orientation of structures on the screen display will be key for accurate localization of the effusion and surrounding organs. Physicians performing chest ultrasound will often have some background in ultrasound from either the cardiology perspective or from the general radiology perspective, like the emergency department physicians and trauma surgeons performing the FAST exam. So, on which side should the probe index mark be pointing? Physicians having a background in echocardiography are used to scan with the index mark of the probe being oriented either towards the patient's head or towards the left side of the patient. Physicians having a background based on the general radiology convention, as are most emergency department physicians and trauma surgeons performing the FAST exam, are used to scan with the index mark on the probe oriented towards the head of the patient or towards the right side of the patient. Note that when scanning in the longitudinal plane of the body, like it should be done when assessing the pleural space for effusion, as previously discussed, with both the radiology and cardiology perspective, the probe index mark will be held towards the cranial aspect of the patient. This orientation of the probe index mark towards the head should be the one used whatever the type of probe used and whatever the chest area you're scanning. Right chest, left chest, anterior, or posterior. As previously discussed, this longitudinal orientation of the ultrasound beam will provide an optimal assessment of the relative position of the various anatomical structures of the upper abdomen and chest, and will allow for the precise identification and localization of a pleural effusion in relationship to the diaphragm and other surrounding organs. Now, the second important question is, on which side should the orientation marker on the screen be placed? On the left side or on the right side of the ultrasound sector display? Based on the cardiology perspective, the orientation marker on the screen will be placed on the right side of the screen display. Based on the general radiology convention, the orientation marker will be placed on the left side of the screen display. Thus, you can see that there is a potential for confusion in relationship to orientation when physicians from different backgrounds work together and share the same ultrasound machine.